And then I had Sherman, who was starting to put a social psychological lens in on hypertension and John Henryism, so I was focusing on hypertension. I had Ed, who could mentor a whole slew of diverse people and really support us through whatever we were doing our research. And then, of course, I had Bert. So that was my...
And Ed was a practicing clinician.
He was
very
on
unusual.
faculty also.
Yes, I remember. He was on my doctoral committee later.
Yeah, and he taught a course in my years in the pathophysiology of hypertension.
Mm-hmm.
So I took that course, and from that, he became my primary mentor. So one of the things I remember about my dissertation experience, I think all of us do, is the primary experience is our first orals, right? And that's all we had. We didn't have a written, we had orals at that time.
Right.
So I froze with my committee at the beginning of the orals, and I remember Castle going up and said, okay, you can do 2x2s in the back of your head, Michelle, so just write a 2x2 table and listen to us as we're talking. And he swung me into the orals, and I felt a whole lot better. But then when I finished the orals and I left and I went into Ed's office, I was there forever. They had, as it turned out, forgotten about me. And, and I'm swinging around in Ed's chair like this, remembering, what is happening to me? Oh my God, I must have flunked. I'm going to be stuck. I'm going to be a no-name, right? So Ed comes running back into his office, and I'm swinging around like this. He said, it's okay. We got to talking about other things, and we forgot you were here.
This was room 202, wasn't
yes,
it?
Right.
202A, if I recall correctly.
I was like, really?
I don't know if that's
an
honor or...
well, it was a classic doctoral student response, too.
So, who was your fifth committee member?
David Kleinbaum.
David Kleinbaum.
Was the statistician on a lot of people's committees at that time,
yes.
right? And that was the fifth member. Yes, you're correct. We always had a statistician. It was David. So my experiences were from the lens of Tyroler and then Castle, you can see, mm-hmm. and then from the lens of this fabulous committee of incredibly supportive old men. And the thing that, one of the memories that I have, well then let me talk about my defense. I mentioned to you, the day before my defense, John Castle died. And I remember actually being quite sick with a headache the night before my defense and saying to my girlfriends, I don't know if I can do this. And they said, you just got to. So I'd already taken an offer at NIH to be at the Child Health Institute in about a month. I didn't have much time. And so the day of my defense was a very sorrowful experience.
Yeah.
The whole department, the committee, everybody was, I would say, 2 standard deviations away from anything you would expect. And I don't remember what I presented, how I presented, what the questions were, or anything, because this whole cloud was over all of us.
Mm.
Yeah. And I stayed to go to the funeral services for John Castle, and if you remember, Mrs. Castle had us all sing "And the Saints Go Marching In," because that was John's favorite song. So we all sang it together, and it was a very heart-wrenching experience. And so that was the end of my time, but in the middle, in the whole cohort experience that I had, there were a number of women in the department, women students. Barbara Holker was a faculty member, and Joan Cornone-Huntley, and a couple of other women. I engaged them in meetings at my apartment in women's, how do you do a women's career in epidemiology?
You did this as a student?
As a student, yes, as a student. And so Pat Dischinger, Mary Daly, Deborah Wynn, Janet Meiniger, and I, and a number of other, Carol Hogue, came to my apartment, and we talked about this. We said, how are we going to do this? How are we going to do this career and then whatever else we want to do in our personal lives? And so I remember Barbara Holka coming to my apartment and talking to us very personally about how she mixed her family, her career, her husband's career, and how you could do it, because there was no role modeling at this time in women. It was just the beginning of that phase of the trajectory of women being professionally involved in epidemiology to the numbers that we have now. Mm-hmm. And so we had a series of these meetings at my apartment. And
What years were those? Do you remember?
those were 73, 74, 75. And we, the cohort of us, still are very close, all these women, because of this. And we shared a number of panels of career, how do you deal with your career as a woman type of questions, because you're always asked. And we all knew what each other's desires were in our personal lives. We were very quiet about it professionally to anybody. And it all worked out the way that we said in those meetings.
That helps to explain why there was such an explosion in my year. So I came in 1977, in fall 1977.
Okay.
There were 20 new students.
Yes.
Would you care to guess how many were women?
Probably 75%.
One? Donna Craigle.
Oh my God!
And Caroline Becker was furious.
Yes, and I forgot about her because she came too. So that's interesting because there were very few of us.
It never happened again.
Yes. Good on her. And Caroline Becker came to my apartment too.
Mhm.
So we became this little force. Now I think because Tyroler had a daughter and Castle had like 4 or 5 daughters, that they were actually more willing to engage in young women being involved in epidemiology than almost any other place in this country.
Interesting.
Because I got to know a couple of John Castle's daughters, and I thought the world of them. And I think a lot of us did. And so with these 2 men, these 2 titans really at the helm of this department, the respect for a woman scientist or a young woman who was training, I think was far greater than any other location you could be in. At least I think we were respected more. We were challenged, we were supported, but we were respected in ways that other environments that I've been in were not the same. I know for a fact because I was in other environments, right?
Mm-hmm.
So,
Yeah.
and so do the others of us because we still talk about it.
Interesting.
It was an interesting time. I went with Ed Wagner to, do you remember Sam Peacock? He was a physician in primary health and in community health, and he had a group of young medical students around his house talking about health and culture change. He had been in New Guinea, and Ed took me to be with these young medical students to give the flavor of what an epidemiologist do in these circumstances, because I knew I wanted to keep my anthropologist lens going throughout my career. And so all of these different experiences, if you think about it, having these women faculty members basically socializing and rearing us in our professions and talking personally about their lives, and then the men taking us into these other groups with physicians, how many other places were doing this? I don't know, especially for the PhD students who were coming through. So I feel that these experiences were the enrichment, the embellishments, grace notes around the whole experience that we had here. And so, as I said, the cohort of us still are very, very close, these women. And Debbie Wynn is the godmother to my child. Yeah, I'm seriously close. And to this day, we are dedicated and committed to the experiences we had because we had so much of this going on. Ole Miettinen and Ken Rothman came to my apartment for a party one time. I mean, you have all these experiences. I don't know if they went on afterwards. And I don't know if I was like the social butterfly for the cohort. But
I think you were special. I don't know. I didn't know most of the Epi students or almost any of the Epi students at that time. But I noticed on your CV that you were one of the outstanding young women in America.
Oh.
Outstanding young women in 1977. Was that before your defense, or you were?
That was right after my defense. I went to the Child Health Institute in the intramural side, and the institute director, Norman Kretschmer, was a pediatrician, PhD biochemist, and I would say a frustrated epidemiologist. He took me to a number of field locations to do research on pregnancy, infancy, nutrition, and growth. Always a desert. First I started with Peter Bennett at his epidemiology station on the Pima Indian Reservation. Do you know about that?
Mm-mm.
So there was, NIDDK had a field station for epidemiologists under Peter Bennett, a brilliant epidemiologist, where Norm took me out to meet Peter. This is unusual for a director of an institute to do so, but he did because he was very dedicated to the area of infant nutrition. And I just raised my hands. He said, so is anyone interested in doing infant nutrition research? And I'm, sure, let's try this. And so I ended up doing this research with a band of people there in trailers, looking at the role of infant feeding practices and diabetes among the Pima Indians, because they had such a high rate of diabetes. And then looking at growth and development across the life course. Again, the life course, and this will just keep going back. And then I conducted research in Bedouin Palestinian Arabs in Israel, looking at them going from dramatic social change within a year of being semi-nomadic to sedentary, and deciding that 33 tribes were going to be members of Israel, not Egypt, because the Bedouin realized Israel was pronatal, and if you delivered in hospital, you would get shekels. And this could start the economic base for these Bedouin to be thriving members of Israeli society. So we went to the Bedouin in 1979, was the first year that I went there, and a team of us from Child Health. And we ended up working with people at Ben-Gurion University of the Negev, Soroka Medical Center there. And this anthropologist on the team with us who had been doing research for years amongst the Bedouin, a woman named Gillian Lawando Hunt, lo and behold, was trained by Sidney Clark. So, yes, so here am I, Castle, here's Gillian, Sidney Clark. There's a paper we wrote. It's called The Interface of Social Science and Epidemiology. And it talks about being disciples of these two men and how they created this thread of research of culture, change, and health. So you never know where you're going to be in your career to find somebody who's trained by a colleague of someone else, one of your mentors. And Gillian and I, to this day, are still very close friends. This Bedouin study went on from 1979 to 1991.
Wow.
We followed them, and the joke was you need to put a magnet on a camel to find them, because they were semi-nomadic. We actually captured them as they underwent this dramatic social change, and they went from living in tents to huts to homes. And I have all of this in papers about how the social change, this rate of social change that was so fast. They went from a birthing pole where you would deliver a baby, which I will tell you, my late husband was a pediatrician, and he delivered a baby in cesarean mode for a woman at a birthing pole. It was, I don't know how he did it, but he did it for the Bedouin. And forever in a day, we were tremendously accepted amongst the Bedouin because he saved the woman and the baby. And so, but they went from these birthing poles to 95% delivering in hospital in 1 year because they recognized the economic base. So all of this research that I've been doing is Life Course, which came from my startup here. I still do it, as you know from the title of my talk today. And a lot of it is housed in this dramatic social change. So I went from Israel to Egypt to Tunisia to Pakistan, and now I'm in Lebanon doing the same thing. So I've never lost that thread from John Castle of this exposure to culture change and how it dramatically influences how you're going to have your life course. So those are the threads that I have from Castle. The other thread that I have, do you remember the Ponape study under Ralph Patrick?
Ralph Patrick.
Right. So Ralph and Castle went out to Ponape, right?
That's in the Pacific Islands.
It's a Micronesian island undergoing dramatic social change. There's another team out of Houston with Stony Salons and Dwayne Reed, who turns out to be my first boss after here. Yeah, in Child Health, he was the head of the epidemiology.
Oh my
program.
goodness.
So you can see where these threads just keep pulling out at you, right? Dwayne and Darwin Labarth, right? And they, the Houston-based team, called it reef epidemiology because their goal was to go snorkeling and scuba diving as quick as they could. But they also trained and taught me the fun of field research, which is something that I evoke with my students to this day. You go to the field with me, we are going to do serious research, but then we're going to go to a shuk and we're going to get dressed in Muslim garb, and we're going to actually have our colleagues help us barter and exchange for different things. I was with a colleague in Amman, Jordan recently, and she had me dressed in a habib and glasses because my blue eyes, and she bartered and she said, Michelle, the only thing you do is you shake your head no or you shake your head yes. Yeah, no or yes, like that, the opposite way. And
Do that again?
Shake your head no if you don't want that
Yeah.
that price for this this garment. Yes, if you do. But
Oh.
don't say a word because you can't speak Arabic
Right,
very
right.
well. Not Jordanian Arabic, and that's tricky because I can speak Bedouin, but that's trash Arabic because they're the lowest of the Arabs.
Oh my goodness.
So I've been told that, and I'm very careful about that.
My goodness.
So it's an interesting phenomenon. So the fun though part that the Houston crowd and Ralph Patrick, I thought he loved what he was doing. I thought he evoked the fun part of epidemiology too. And so I took his classes. Did you take any of his classes?
No, but he was on